So this is male reproductive disorders. I'm going to start with prostatitis. Prostatitis is found in your book in chapter E9. So it's chapter E9 1, or page 1 of chapter E9. You can get it through the internet, or you can get it off of the posting in Blackboard. I have it posted in the weekly learning of this week. Um, so, what is prostatitis? It's really inflammation of the prostate. It's any one of multiple disorders that cause pelvic pain and inflammation of that the prostate. Uh, it it can be simple acute bacterial infections. It can be caused by some sort of uh, dysfunction of prostate and blocked ducts within the prostate that where it's not draining properly. It can be all over the place, um, but most of the time, prostatitis is painful, um, and is defined uh, often as pain. Uh, a lot of people get it. This says that 10 to 15%, 10 to 50% of men between 20 and 74 years of age will have symptoms at some time. In the textbook, it says about half of all men have at least one episode during their lifetime of prostatitis. The prevalence is highest in around age 40. It's not an old man's disease like some of the other prostate issues. It can be a young man's disease. Can happen at any time. Often it's involved with infections, urinary tract infections, bladder uh, um, obstructions, and flow problems that will back up into the prostate and affect the prostate. Uh, it's a problem that often follows catheterization. I'm having trouble saying that word tonight. Um, it's it STIs are often involved with it. So multiple sex partners all increase the risk of developing prostatitis. Emotional stress, alcohol, caffeine can trigger episodes of it. A lot of people with diabetes end up with prostatitis. They end up with a lot of urinary tract infections because there's sugar in the urine that shouldn't be there, and that will feed the bacteria. So it's kind of all over the place, and it's a very broad demographic from um, young people right to elderly. I don't know why it says 74 years and not 76 or 82. It's kind of all men from puberty until they nail the lid on the box are uh, have problems with this. Um, so what happens here? It's the prostate doesn't drain properly. The secretions build up, and they can become stagnant. They can they become if they become infected. It all becomes something is irritating the prostate. So there are four basic types, categories. So category 1 is acute bacterial prostatitis. And this is exactly what it sounds like. So this is an acute bacterial infection of the prostate. Uh, the It could become a persistent urinary tract infection that the organism is hiding out in the prostate. It you know it can be any sort of this acute sort of thing. Now the type 2 and this acute bacterial is actually the least common of the 4 types, but it's really easy to diagnose and it's really easy to treat. It's a bacterial infection, so antibiotics will do it. Chronic bacterial prostatitis is also fairly uncommon. There's some underlying deficit of the prostate. It can be a tubular change, can be the presence of some stones, it can be something like that. And then what ends up happening is there's a locus of this infection that just keeps on breaking out. And it's often very difficult to treat this unless they go in and remove or fix the deficit that is there. The most common type is type 3, which is chronic non-bacterial prostatitis, which is really a painful syndrome, chronic pelvic pain syndrome. It's the same thing. And this is no infection, right? But you find white blood cells in the semen. There's it might even be in the urine. This is again the most common, and it generally diagnosed by the pain. And they use different treatment methods to try and deal with it, because it could be caused by any one of a number of things. Usually, though, painkillers are a common thing. So the type 4 is there is no pain. It's asymptomatic inflammatory prostatitis. So it's inflammation of the prostate with no subjective symptoms. The guy doesn't complain about it. White blood cells are found in the in expressions of the prostate or in semen, but there's no pain involved with it. It's usually found incidentally while they're looking for other things, like at infertility clinics and that kind of thing. Really, it's the painful non-bacterial, so the type 3 that becomes the one that is the most common, the recurrent one. So if it's bacterial, what you're going to get is all the symptoms of urinary tract infection. So you get a burning on urination, but you get this horrible pain in the pelvis, in the testes. There might be a discharge, so it might look even a little bit like gonorrhea. You have systemic problems with fever and that kind of thing. And when the prostate is palpated digitally through the rectum, it's hot, not necessarily enlarged, but inflamed and hot. Now, the chronic prostatitis, the chronic pelvic pain syndrome, doesn't have these systemic things because it's not an infection. So there there's no there's no fever and malaise, uh, and generally uh, has normal palpation. So there's no abnormal palpations to it. Um, so a lot of these guys have voiding problems, and a lot of them have sexual dysfunctions. They get erectile dysfunction, they have ejaculatory pain, and that usually bums them out. So there's often depression involved with it. So these type 1s could turn into type 2. They can become uh, chronic. And and if you have this chronic prostatitis, there's flare-ups and there's uh, and remissions, and it kind of goes with stress and health and other things uh, like that. Now, the chronic uh, the chronic prostatitis often is relieved by ejaculation. The pain goes away when the prostate gets used, uh, and so uh, quite frankly, that's the kind of the treatment of choice. You know, ejaculate often. Um, Sometimes it seems like kidney stones too. There's might be a burning into the tip of the penis. So the real complication of it is if the prostate gets enlarged and starts to compress on the urethra, then you can get an obstruction and urinary retention. It can be quite a, a bad thing. Um, I just today had a, somebody came in and she was telling me that her partner ended up with prostatitis and a urethral obstruction, and he wasn't able to pee. So he was catheterized, and a clot got into the catheter and blocked it, and so he called telehealth and was told just drink lots of fluid. Well, I guess he didn't explain it well enough that he wasn't able to pee. Well, drinking lots of fluid was not a good thing, and he ended up literally tearing his bladder, and he goes for surgery the day after tomorrow to try and repair the damage to his bladder because of this thing, and he may have permanent issues because of this urinary retention and literally little micro tears in the walls of his bladder. Um, it says here the diagnosis is ruling out BPH and prostatic cancer, but those two don't hurt. So the pain usually rules that out. So really, it's urinalysis. Uh, you know, prostatitis will raise the PSA levels on blood tests, but so will cancer, and so will benign prostatic hypertrophy, etc. So um, the PSA is not really a diagnostic test. It's really urinalysis and analysis of the specimen, an expressed prostatic specimen. So they do what's called prostate massage, and so they palpate rectally and literally just massage it until there is secretions come through the urethra, and then they they collect them and they analyze them. Digital exam, manual palpation is looking for changes in the prostate, and that's done a lot. Probably a more pleasant way of getting prostatic secretions than prostatic massage is to get a semen sample and analyze that. Look for white blood cells and such in that. The big thing and the, the big change is that this causes pain, where the other two common prostate issues don't generally cause pain. So type 1 responds to antibiotics. Type 2 usually doesn't. So they have to correct whatever is going on. So if there's stones, if there's any sort of an obstruction, then that has to be dealt with before the antibiotics will work. Type 3, all over the place. Anti-inflammatories, frequent ejaculations, dietary supplements, etc. I'm not certain where massage can be useful in this. These guys tend to be very uncomfortable.